Hello, my name is Kelvin Maratin with Nometric D2019108745 Today I will show you a few tests on the shoulder assessment. For the first test, it is the speed test. What to do in performing the speed test is first, the elbow is fully extended with the arm is elevated to 90 degrees and extended slightly horizontally. Next is we put the forearm supinated and the examiner will apply a downward force. So after the force is applied, the test will be considered as positive if the patient complains pain during the forward elevation. Next is the Hawkins, or also known as Kennedy test. So for the procedure, we can see the video. The patient is sitting or standing with the shoulder, elbow, and wrist in anatomical position. Next, the examiner will stand lateral to and in front of the involved site with one hand grasping the patient elbow and the other hand grasp the patient wrist. Next is the elbow and shoulder will be flexed to 90 degree. One position properly, the humerus is passively internally rotated. So, a positive test is indicated if the patient experiences pain with motion, especially near the end of the range of motion. This test may indicate pathology of the rotator cuff muscle group or the long head of the bicep brachii tendon. The motion of the test impinges the structures between the greater tuberosity of the humerus and inferior side of the acromion process. For the Yergason's test, for the procedure, first, the patient should be seated or standing in the anatomical position. So next, the humerus of the patient in a natural position and the elbow in 90 degrees of flexion in a pronated position. So we can see in the video. After that, the patient will be asked to externally rotate and supinate their arm against the manual resistance of the trapeze, which is produced by wrapping the hand around the distal forearm, which is just above the wrist joint. So, if the Yergason test is considered positive if the pain is reproduced in the bicipital groove and a biceps or a SLAP lesion is suspected. If so, in addition, if a clicking sensation familiar to the patient is produced during the test, damage to the transverse humeral ligament, this ligament, which is ovalize the intertuberculous sulcus, should be suspected too. Next is the Neer's test. So for the procedure, first one is we need to stabilize the patient's scapula with one hand and then pronate the affected arm and passively forward flex the arm as high as possible. So this will pinches the rotator cuff muscle under the coracoacromial arch. Then the test is considered as positive if there is any pain reported by the patient. Moving on to the next test, which is the MT-CAN test. So first of all, the patient can be seated or standing for this test. Then for the arm, the patient arm should be elevated to 90 degrees in the scapular plane with the elbow extended, full internal rotation and pronation of the forearm. So this movement of motion will result in a thumbs down position as if the patient were pouring liquid out of a can. So for the therapist will stabilize the shoulder while applying a downwardly directed force to the arm, and then the patient will try to resist the motion. So the test will be considered as positive if the patient experiences pain or weakness with resistance. For the full can test, the full can test is used to assess the function of supraspinatus muscle and tendon of the shoulder complex. So we can see from the video before, which is the MT can test. So with the positive MT can test, one cannot distinguish if the pain is due to the impingement or due to the rotator cuff muscle dysfunction. Therefore, the full can test is used. So for the procedure, the first of all, the patient can be seated or in standing position for this test. Next is hold the arm in 90 degree of elevation in scapular plane, 30-degree anterior to the frontal plane with full external rotation of the glenohumeral joint. In this position, the patient thumb should be pointing up. And then the therapist should stabilize the shoulder while applying a downward force to the arm while the patient tries to resist the motion. This test will be considered as positive if the patient experiences pain or weakness with resistance to the shoulder complex.